LASIK is the most common form of vision correction that's available worldwide. It's been around really since the mid-1990s. So when people talk about all laser LASIK or laser-based LASIK, what they're really referring to is not the laser that's responsible for fixing your vision, because that's the same as it's always been. What they're really referring to is a second piece of equipment, a different kind of laser that's now involved in the LASIK process, whose job is just to make the LASIK flap. And that's been probably one of the biggest changes that we've had in LASIK in the 12 years that I've been practicing. Essentially, the eye is really not that much different than a camera. And the front structures in the front of the eye, which is the cornea, is the very front structure in the front of the eye, is essentially the lens system of the camera. So most of the light that gets focused in the eye, in the camera of the eye, if you will, really comes from that curvature of the front of the eye, which is the cornea. So the way that your contact lens fixes your vision and the way that LASIK fixes your vision is by basically changing the curve of that front window. And the amount that the laser flattens the cornea is directly related to how much prescription a patient has. So in a nutshell, LASIK is basically a relatively simple procedure where someone has a starting curve to their cornea, and that's partially responsible for why their eye is not properly in focus. The laser is then used to either flatten the cornea or steepen the cornea to make the eye properly focused, essentially. The first step in the LASIK procedure has always been the creation of a very thin corneal flap. And usually that flap is about 100 microns, about 1/5 of the thickness of the total cornea. And historically, the way that flap has been created is with an instrument that was a mechanical device that actually had a blade in it. And that's the way that most LASIK has been done throughout the world over the past 15 years. And that's the way that most LASIK is still commonly done in many parts of the world. That part of the LASIK procedure has always been the part of the LASIK procedure that, technically speaking, can be the most responsible for certain types of complications. So for example, when we think about LASIK and dry eye, or we think about LASIK and other issues that sometimes are concerns, really it's the LASIK flap in the procedure that is mostly responsible for that. So having the laser capable of doing that step has really changed things dramatically. Step 2 is the same as it's always been. You know, that's probably the part of the LASIK procedure that in some ways has changed the least in the last 15 years. Probably the biggest change that's occurred on the laser side of the equation, the part of the procedure that's actually responsible for correcting your vision, has been the advent of things like wavefront guided ablation or customized ablation or topographic guided ablation. And these really refer to the method by which we tell the laser exactly what it is we want it to do at the time of a patient's treatment. And that has changed, particularly in the area of vision quality and vision quality at night. If you had to pin your hat on one thing about laser-based flap making versus mechanical microkeratome, where the blade is involved, probably the simplest thing is that it's just a safer way to do the procedure. You know, you don't have the risks or worry about a mechanical device that has a moving part, that has a blade that's doing the cutting. Instead, what you have is a very sophisticated laser that is not really in direct contact with the cornea, that's making a cut using light, basically. And it's just a much inherently more elegant way of doing that step. People ask me, you know, it must be satisfying to do LASIK and it must be great getting people out of glasses and so forth. And the answer to that is unquestionably yes. But one of the things I think that people sometimes don't appreciate, that I appreciate, is LASIK does more than just get people out of glasses. And a lot of times it really depends on where the patient is coming from.
I can definitely say that I think LASIK is life-changing. There's so many people that come from different walks of life, whether they have active outdoor lifestyles or whether they have a physical handicap and can't actually physically, you know, put those glasses on their face or get the contacts in their eyes. I mean, having LASIK is just an amazing opportunity. It's always been my dream to climb Mount Everest. I was a contact lens / glasses wearer, and it would be very difficult, and there was a lot of risks involved with putting contacts in at such high altitudes as far as cleanliness and potentially getting an eye infection. So this led me to seeking someone to do some LASIK for me. It was really a challenging trip as far as the natural elements that were against us. First off, it was bitterly cold. There was days when it was -25, and it was also very, very windy. I cannot imagine having to put contacts in with that level of wind and cold, because I had to have my hands covered the majority of the time. And to wear glasses just wouldn't have been feasible because we had to have goggles on our face. So I think that the LASIK really, it was sort of a no-brainer. It was a necessity for me to do, and I'm really glad that I did it. After my experience on Everest, I can definitely say that I think LASIK is life-changing.
So some things that we take for granted, just something simple, but like a lifelong dream of climbing Everest, for example. And so we have had cases like that where people have one specific item that's on their checklist of things that they want to do before they can't do them anymore. And it's amazing how often glasses or contacts can get in the way of that, you know. And climbing Everest would be one of the things that stands out. And I can't tell you how many patients I've had where it's something similar to that, you know, something where there is one particular aspect of their life or a passion that they really have that really is interfered by their dependency on glasses or contacts. The flip side of that coin are patients with multiple disabilities. You know, a group of patients that we don't think about very often, patients who are confined to a wheelchair or have quadriplegia or have some other problem. And simple basic things like pushing your glasses up your nose and they fall down your nose, or putting contact lenses in, are things that they have to ask somebody to do for them. And we have experience with those patients too. And LASIK is much more in those cases than just getting that patient free from glasses or contacts. It changes their life in a way that's very different than just the added convenience for them.